140,000 Americans are expected to die this year from a stroke, and today we want to bring you to the attention of a type of stroke, I should say, with an obscure or unknown origin, as the definition says it. Our stroke program medical director at Rio Grande Regional Hospital, Dr. Hamza Sai, is here to explain. Doctor, thank you for your time.
Thank you, Michelle, for having me.
Definitely talking about strokes is not easy because you don't know when it might happen to you, but tell us about this one in particular.
Correct. So cryptogenic stroke, it really means a stroke of unknown origin, a stroke where you don't know where that stroke came from. It's devastating because, again, if you don't treat the underlying problem, you could definitely have a recurrence of a stroke. So that's why it's very important for us to know the etiology of every stroke. Some studies have shown up to 40% of strokes come from an unknown origin. So in case of we have to do every possible thing that we can for the patient to find out about the etiology of that stroke, we could try to prevent the recurrence of the stroke.
Interesting. Now, how do you go about that? Because I can imagine there's many steps and many tests, and maybe patients out there could get upset or overwhelmed with the findings of this.
Absolutely right. And for strokes, again, the risk factors for stroke that we know about are very common in regards to the atrial fibrillation, the cardiac arrhythmias, the hypertension, high cholesterol, and high diabetes. But when patients come with a stroke who don't have any of that, that's when it leads to the further cascade of events that I have to do in regards to doing more genetic testing, more CT, more imaging of the whole entire body to make sure there's nothing else related that is causing a hypercoagulable state in the body or a tendency to develop clotting. So it becomes much more vigorous than that, than the typical signs and symptoms of a stroke.
Certainly, and Dr. Sai, we want to encourage everyone out there, residents, to go learn more, especially from your stroke program. So if you can tell us why it's so important that they raise awareness and stay educated.
Absolutely. Like you said, a stroke is a very common disease. Unfortunately, it's the #1 most common debilitating cause of debility in the country. And what we're doing at Rio Grande Regional is trying to focus on stroke care, and not just the treatment, but the actual prevention of it as well. We were doing a great job recently. We were awarded a stroke award from the American Heart Association and American Stroke Association.
Congrats.
Thank you very much. And again, what we're trying to do is to try to treat the stroke in the quickest way possible and to try to prevent other ones from happening again. We have the only vascular neurologist in the Valley, and we are very pleased to offer that service to people here in the Valley as well.
Very good. Dr. Sai, thank you so much for that information. Stay healthy out there.